Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and as always, our guest is Fran London. Hi, Fran.
Hi, Chuck.
Fran is the Patient Education Specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she is the author of the book, let me hold it up here, No Time to Teach. And this is the book where we get most of our topics from. But Fran, I got a question via email this week from Sara Swanson. She is a nurse at Seattle Children's Hospital, and she had a question regarding using video. And she said, the $1 million question, remember when it used to be $64,000 question?
I do.
Yeah. The $1 million question is when and where to have families watch videos in order to supplement your teaching. It has to be incorporated into the care plan and be exactly what the nurses want. Okay, so think about that just for a second. And I'm going to start where I think you probably want to start, and that's with the what. She says exactly what the nurses want. Let's hope that's also what the patients need as well, just being devil's advocate here. But why don't you address the content first?
Well, it's got to be based on assessment. So what does the patient need? And what you want should mean evidence-based information that's appropriate for that patient. But it should also be useful for the patient. Otherwise, why bother spending the time on a video?
Yeah, sure.
So, yeah, it's the what should be the right content.
Yeah, and I think you also had mentioned in our emails going back and forth that we want to make sure that it's not cluttered up with editorial comments and specific vendor mentions and things like that, because the patient really needs the crux of the information.
Yeah, it could be sponsored by a vendor, but it shouldn't be an advertisement. It should be, either answering the questions of what's going on, how do I treat it, what do I do if there's a problem. It should be functional.
Yeah. Now I'm going to go ahead and ask an obvious question and have you address it because I know from experience sometimes we put in video systems and the nurses don't always know what's in the videos, and if they don't, they can't use it. So you want to address that as well?
Yeah, that's a real issue because in order for the assessment to be matched with an appropriate video, you have to know what your resources are.
Right.
You wouldn't hand a patient a handout without looking at it first. So why would you show them a video without knowing what's in it? And also the best way to use videos is to introduce the video before you show it. Tell the patient what it is you want them to notice about the video, what you want to discuss after, and then do the teach back after to find out if the patient got everything that was important out of the video. So you have to know what's in it in order to use it effectively.
Yeah, and then to your last point about teach back, you have to be able to do that in order to find out if progress is being made in learning. Otherwise, you can't move forward. You need to stay on that same topic, and maybe they rewatch the video, or you look for another one that might supplement that, or you take a different tactic if it's not sticking, right?
Yeah, it might be misunderstood, or
Yeah.
it might be too complex, or whatever.
Yeah, okay. So that addresses the what. Now let's address the other parts of her question. The next one would be the when. She wants to know, is there a right or a wrong time?
Well, it's the same as any other patient education intervention. You assess whether or not they're ready to learn this content. Obviously, if you're showing a video, you want them to be able to see and hear at the time, and you want them to be alert, and they have to be interested in doing it, or if they're on medication or sleepy, then it's not a good time. So it's best to prepare them and to make sure that you're using it at a time when it's going to be effective.
Yeah, and one of the terms that I hear bandied about often is the teachable moment. And that's when the patient perhaps has volunteered a clue, maybe by asking a question or something, making conversation that gives the nurse a clue that hey, they're alert and interested in knowing a little bit more right now. And so perhaps now would be a good time to do it. And the other option would be because many times the patient has family caregivers, finding out when the family is going to be there.
So that they could also watch the video.
Yeah.
Absolutely.
Yeah.
Yeah. Going back to the teachable moment, I think that's important because if you know your resources well, if you know your handouts, if you know your videos, and you know what you've got, then when you hear that teachable moment, when the patient asks a question or expresses some concern about some issue, you could say, oh, I've got something great for you, and then introduce it. So even if you can't discuss the video at that point, you could get it started and then talk about it later, but at least it's given at the time that it's going to be most useful.
Yeah, and from a time management standpoint, that's actually a very good way to approach it because the nurse is not always going to have a block of 20 minutes where he or she can devote that time to the patient because they have other things they've got to do, whether it's medications or checking fluid lines or whatever. So the minute or two that it takes to set the video up and even order it for the patient can start the learning process while they go off and do other things. So they come back and they do the teach back and ask the questions, look at the patient's notes, and the learning process continues even though the nurse is not in the room.
That's the best use of video. Absolutely.
Yeah, yeah. Now, from the when is the where. Where should they watch the videos? Obviously, in the hospital is an option and preferred before discharge, but then, of course, there is at home and on mobile devices. And then, one question I would have is, does it really matter as long as they watch it?
Well, it depends a lot on what the purpose is. If you're introducing a new topic, clearly doing it in the hospital is most useful because then you could do the teach back after and clarify misperceptions. If it's for purposes of following instructions or reinforcing information, having the same video available at home, whether it's through the internet or whatever, would be quite helpful because, again, repetition is useful for helping the message to get through.
Yeah, and let's not forget that all of us don't have the minds of a 20-year-old. We forget a lot. That 20-minute drive home from the hospital to the home, there's a lot of stuff that just fall right out.
and when you see a video more than once, you also notice different things.
Yeah.
So that's helpful too.
Yeah, it's like watching a movie. How often have you watched a movie for the second or third time and going, I don't remember that at all? Or, you saw a different perspective.
Yeah.
Yeah, same kind of concept. Okay, and then the last part of this is the how. And from Sarah's perspective, it was how should the process be incorporated into the care plan? Is there one right way to do that?
No, obviously.
Yeah.
But I think the key is all the tools should support what the care plan is aiming to accomplish. So if the care plan includes the patient needs to go home with specific skills in hand, then the video will be part of that process. When you put it in, obviously has to be the right timing in order for it to be effective, but it shouldn't be you must do this today now, whether or not they're ready to see it. That's not a useful way to use video.
Yeah, and if you think about it, the whole patient education process is fluid, and it's all based on the assessment. And the assessment's not done once, but it's done multiple times simply by asking questions. Much like when they come in to do vitals, they check the patient's pulse and blood pressure. Well, you can also kind of check their alertness, if they're ready and willing to answer questions or ask questions, and perhaps that's a good time to discuss something or show a video or whatever. But the how so much depends upon the patient's mindset at the time and how it flows over the course of their inpatient hospitalization. And you kind of have to, you got to have your antenna up. You got to pay attention. Because if they're not ready, willing, and able to listen, you're wasting your time. Be better to do it a little bit later. So the incorporation into the care plan needs to be one perhaps of, here's the ongoing assessment of where the patient is. Here are the things he or she does comprehend and has knowledge of and has a skill set. And these are the things we're still working on. And as that changes over time, and their knowledge graph goes up, the closer they get to discharge, then that's really how it should be incorporated so that everybody knows where they are. It can't be just the day nurse knows what's going on and the night shift doesn't have a clue, or they don't discuss it at bed shift change, those kinds of things. You see what I'm saying?
Exactly.
Yeah.
Exactly.
Okay.
Yeah, it's got to be a big picture.
Yeah, and there's not, you got to follow these 5 steps in the right order because it's fluid, because you can have a situation where the patient gets something but doesn't get something else, and you may have to redo some things, and you just keep going through that process, and it's constant, and it's fluid and flexible, and you just got to go with the flow based upon the feedback you get when you do the assessment and the teach back along the way, right?
Exactly.
Okay. All right, cool. Well, this was a great question. I appreciate Sarah taking the time to email us about that, and I'll be sure and let her know that we recorded this episode, and it usually takes me a couple of weeks to get them out, but we'll get this out shortly. So why don't you tell folks where they can find you online?
I've got a blog at www.notimetoteach, and I'm on Twitter at NoTimeToTeach.
Okay, and I know that you're also on Google Plus and Facebook and other things, and I'm seeing you more active on Google Plus here lately.
It depends on my mood and
Yeah.
what it is I'm trying to communicate.
I know, it certainly is. And I want to let folks know that your book is available wherever books are sold, certainly at Amazon and other book resellers in paperback and ebook form. And there is a sizable discount for folks that want to do a group purchase and for in-service work, things of that nature. I think it's 40%. And the way to get that is to go to your publisher's website. That's Pritchett and Hull. And their website's really easy, p-h.com, and pick up that discount. And for those folks that are interested in adding video to their patient education process, you can visit our website at synergybroadcast.com, look under Solutions for Patient Education, or you can Google Medical Media Delivery System, that's what we call it, MMDS, and find out some information there. So Fran, thanks so much for your input today. It was good info. I appreciate it, and we'll see you next time.
Okay. Bye, Chuck.